Good morning. My name is Ivan Clarence Mundaros, a student nurse from Davao Doctors College, and for today's video, I will going to perform a bed bath return demonstration. A bed bath means to wash someone who is in bed, and it is important because it cleans the skin and it helps the skin be free from infection. It helps relax the patient being bathed, and it helps him or her to feel better. Prior to conduct of the procedure, I am going to perform a hand washing to protect my patient and myself as well from infection and cross contamination. I have closed the light, I have closed the door, fixed the curtains, and adjust the room temperature and provide adequate lighting to ensure my patient's comfort and secure my patient's privacy. Third, I have prepared necessary equipment needed beforehand to conserve time and energy. The equipment are as follows as wash basin with warm water, liquid soap, a washcloth, a bath blanket, bath towels, moisturizing lotion, deodorant, eye drops, working gloves, eye patch, and hair comb. So, good morning, sir. I am Ivan Clarence Mindaros, your student nurse for today. May I know your name, sir?
Angelo Estrella.
Your birthday, sir?
October 14, 2003.
Your address?
Barangay Dawis, Purong, May.
Okay, thank you. So today I will doing a bed bath, which means that I'm going to wash your body and remove the accumulated dirt, oils, perspiration in your skin, and of course for you to feel refreshed. Is that okay with you, sir?
Yes, sir.
Okay. So I will be going to start. Would you like void at this time, sir?
No, sir.
Okay, now I'm going to don my gloves. In the hospital setting, naturally I'll have to raise the bed in a comfortable working height and lower down the side rails at my side. After doing that, I have to assist my patient to move closer to my side of the bed. Please say, sir, I'm going to drape about. I need you to move her a little, sir. After that, I'm going to drape a bath blanket over my patient. And remove the top sheet of the beneath the bed, beneath the blanket. And now I need to remove my patient gown. So if the patient has an intravenous line injuries or reduced mobility at one side, then I should toward the unaffected side. Please slide out your hand, sir. After removing the patient's gown, I have now here a wash basin with warm water. It about to two-thirds full, which is at 43 to 46 degrees Celsius, but I am going to let the patient check the temperature if it is tolerable for him. So sir, can you stick your hand inside and tell me if the water is too cold or too hot, sir, for you?
Okay.
Okay. Okay, thank you very much, sir. The next thing that I am going to do is to remove the pillow under my patient's head. And then place a bath towel under the patient's over his chest. Do you wear any contact lenses, sir? Okay. So I'm going to start by washing your eyes first. So in washing the patient's eyes first thing to do is to soak the washcloth in the water, rinse thoroughly and fold it to create a bath mitten. So I'm bathing the patient's eye. You should to start from the inner canthus to the outer cams using a separate section of the cloth for each eye. After washing and drying the patient's eye, I am going to proceed to washing the patient's patient's forehead, cheek, nose, ears, and neck. Sir, would you like to be soap to be used on your face, sir? Okay, starting from the forehead, then cheeks, nose, ears, and neck. If a patient is unconscious, we should wash the eye with warm water only, starting from the inner canthus to the outer canthus using separating section of the cloth for each eye. Instill eye drop if prescribed. If the patient has no blinking, we should leave the eyelids closed and place an eye patch or shield on his eye gentle. So I'm going to place a towel beneath his arm. And then start to wash his arm in a distal to proximal manner, which means from the head to axilla. Using long firm strokes, I am going to start to wash my patient's arm and proceed to the hands and nails. Then have the patient raise his arm over his head and slightly support it. Now that I can start cleaning the patient's axilla. Use deodorant if needed. Now that I am done with my patient's left arm, I'm now going to proceed to the exact same to do the exact same steps with his right arm. Washes the chest and abdomen. Washes the chest and abdomen. Spread the towel across the patient's chest while lowering the blanket to umbilical area. Lift the bath towel of the chest and bath the chest and abdomen. using your mitted hand using long firm strokes, and then give special attention to the skin under the breast and other any skin folds, particularly if the patient is overweight, rinse and dry well. Washes the legs and feet. So now I am done with my patient's chest and abdomen. I'm going to move to my patient's legs in order for me to wash his legs. The first thing to do is to expose his legs by folding the bath blanket to the midline. Keeping the perineum covered, and then place a bath towel beneath his legs. Using long firm strokes, I'm going to wash my patient's leg, starting from the ankles to the knee. And from the knee to the leg. Assess for any skin redness, swelling, bruising, or pain. Now start cleaning the patient's feet, toes, and toenails. Pay attention to the skin between the toes and toenails. Then apply lotion. Reverse the coverings and repeat to the other leg. Now apply lotion. Now discard the washcloth and maintain the patient's privacy. Refills the basin with clean water. So now with the new refill basin and new washcloth, the new pair of gloves, let's perform the perineal care. And I have the new refilled wash basin with a warm water. Now for the last part is to wash the back, and I will going to assist my patient to a prone side lying position so that I can clear his back. Okay sir, I need you to lie facing your side. Okay. Now I'm going to place a bath towel at the side of his back. So now I'm going to start cleaning my patient's back and buttocks and paying special attention to my patient's skin fold. If the patient's skin is intact, then ask the patient if she'd like to begin a back massage. Sir, would you like me to give you a back massage, sir?
No need, sir.
Okay. If not, then apply a moisturizing lotion on the patient's back. So now I am done bathing my patient. So sir, you can roll back now, sir. Okay sir, I have here a new clean gown. I'm going to help you to wear it. Now help the patient with his grooming by combing his hair. Okay sir, now that I am done your bath, how are you feeling?
I feel good and refreshed.
Okay, good to hear. Since we're done, I am going to head out now and let's have you some rest, okay? If you need anything, don't hesitate to call me using this phone call right here, and I will come back. Is that okay to you?
Yes, sir.
After doing the procedure, I am going to proceed to doing the aftercare of the equipment that I have used in order to maintain cleanliness and orderliness. After that, I am going to proceed hand hygiene and document the procedure that I have just done.